Hello and welcome to the Physical Activity Education Session number 2 with the Minto-Mapleton Family Health Team. My name is Sandy and I'm one of the kinesiologists at the Palmerston site. Thanks for joining me today. For today's agenda, we're going to talk about the exercise components and some of the safety tips that you want to consider when you're trying to become more active. We're going to talk about overexertion and what that feels like and what you want to watch for and what you should notice. We're going to talk about some of the common barriers people have when they're trying to incorporate more activity into their regular routine. Some of those barriers include pain and angina often, so we're going to talk about those ones in more detail, as well as shortness of breath, which is what the SOB stands for. We're also going to talk about some other safety considerations, so for when we have patients exercising with diabetes or weather tips, as well as other illnesses that we need to kind of take some considerations into mind. We're also going to talk about how do we progress exercise so that we continuously get the benefits that we want from it. And we're also going to talk about tracking and kind of how to stay motivated. So let's get started with some basic safety tips for exercise. So a good thing to do before we engage in some exercise or physical activity is just to warm up. So we just want to get the body moving just gently, easily, kind of doing the same motion that we're going to be doing in our activity that we're planning. And we want to do that at the very start, just to kind of ease into the activity. This is especially important if you're just starting, but also if you've been exercising for a long time, we still want to do a warm up at the beginning. And when you're just starting your exercise, you want to focus on building how long you're exercising for, as well as how often you're exercising, and not worry about the intensity initially. So kind of build your goals of duration or time and frequency first. And we want to kind of gradually build that about every 1 to 2 weeks until you kind of reach your goal. And then we can focus on trying to get faster and faster or increasing your intensity with the exercise. It's important to pay attention to how you're feeling. Listen to your body. You know your body better than anyone else. And so trust how it feels to you. We also want to end our exercise sessions with some cooling down, which is basically similar to the warm-up. It's just going to slow that heart rate and blood pressure back down to those more resting values. And then we're going to incorporate some stretching in our cool down, which helps to reward the muscles afterwards for the work that we just put them through. And once we kind of meet our time and frequency goals, we can focus on intensity, and we're going to gradually work our pace to get to kind of our optimal exercise range. And you would use things like how it feels, the talk test, or a heart rate range to gauge when you're getting into that optimal range. And we did talk about that a bit more in session 1. So we're really going to focus on overexertion here, which would be the right-hand side of our table that's shown here. But we are also going to talk about what exertion and good exertion should feel like, and so what's normal, and that's kind of on the left-hand side. So let's start with what exercise should be feeling like, what we should be noticing. So we do want to increase our heart rate when we're exercising. We also want to notice a change in our breathing, that we're breathing deeper, that we're breathing a little bit faster, even into a pace of what I would call huffing and puffing. We want the exercise to challenge our heart and our lungs so that they get a little bit stronger. That's the whole purpose. We might be sweating. It's not always an indicator of exactly how hard you're working, but just that the body needs to cool itself. So knowing that you might notice some sweating happening. And we also might feel a bit of mild muscle soreness following our exercise routine. And that's normal. That's what we would expect from time to time with our exercise. However, what is not normal, or things that you should be kind of concerned about, or raise it to your family doctor, or definitely one of the kinesiologists here at the family health team. If you're participating in our gym classes, a good time to talk to us about that. So we definitely don't want to be noticing any chest pain that can maybe radiate up into the neck or down the left arm or across the shoulder blades into the back. And so if you're noticing that with exertion, it's most likely angina. So let us take a look at that and help you alleviate that. It's not what we want to kind of push ourselves into, so try to stay away from experiencing chest pain with exercise. We also don't want our breathing to get extreme. So we don't want to find that we're wheezing or having an inability to kind of catch our breath. And we definitely don't want to get easily short of breath with very light activity. So if that's happening, again, let us know. That's not really normal, and we'll try to kind of figure out the root cause of that. And we definitely don't want to push ourselves into not being able to communicate or gasping for air. And so, yes, we want us to be huffing and puffing a bit towards the end, but not so much that we're unable to communicate. And so sweating is okay, but we don't want to get it to the point where we're now feeling maybe lightheaded or nauseous, sorry. We definitely don't want to notice extreme fatigue or even numbness in any area. So that's just maybe indications from our body letting us know that we're maybe pushing ourselves a little bit too hard in this. So kind of figuring out what might be causing that. Be curious about why you might be feeling that. So making sure that you haven't skipped some meals or missed out on some nutrition before exercise, that you're staying hydrated and watching those symptoms as well. Exercise should feel good. All movement should feel good. We should know we've done something at the end, but not feel unwell from it. And then finally, that muscle soreness shouldn't progress to feeling a lot worse. We shouldn't notice that we can hardly maybe even get down to the toilet, like we can hardly sit down because our leg muscles are very, very sore. That is usually indicative of, gosh, I overdid it. I tried to do too much. And next time we go out, we'll just maybe try to cut that back a little bit just to let the body get used to that. We'll talk a little bit more about mild muscle soreness in the coming slides, but some of the other barriers that kind of people encounter when they're trying to incorporate more regular exercise would be not having enough time or not feeling motivated or even knowing what they should be doing. Not seeing the results from exercise or having the support that they need to be able to do it. Pain is another thing that we'll talk about a little bit in more detail on the next slide, as well as shortness of breath or trouble breathing. And any others that maybe some of you might think of. If you have something that we don't kind of cover on this slide today, make sure to kind of jot that down and feel free to ask one of the kinesiologists or anyone in your program that you're working with us here, and we can help you kind of problem solve and kind of brainstorm ideas to kind of overcome those barriers. And so time and motivation often kind of go together. So finding ways to maybe find short bursts of exercise in your day is helpful. You can break down the recommendations that we reviewed in session 1 to 3 shorter sessions over the course of a day. Anything is better than nothing. So whenever you can find a little bit of time in your day to do some motion, it's really, really good for you. Knowing what to do, that's kind of where our program comes into place. We can kind of share with you how exercise should feel, and it's really just about kind of moving your body. And so anything that kind of pops into your mind about getting more active is probably a good thing to try. If it's kind of an idea you've come up with, it's maybe something that you feel would be doable and manageable for you to give a try. So please try to take those thoughts and put them into a bit of action. Seeing results is often a hard thing for people. We want results kind of quickly, and it takes time to see the added benefits of being more active. But we just want to even notice, usually just after a single bout of exercise, we usually just feel better. And so we really encourage you to notice the changes that you feel pre and post motion. Usually things are moving a little bit more freely. You have more energy, your mood was lifted from it. And that can be sustained with consistent exercise. And so just looking for those small changes, how you feel when you're more active compared to not active, usually can act as a little bit of a motivation. The results happen, so gradually that sometimes you forget where you started from in your journey with exercising more. That we would really encourage you to try to see those changes, to use that as a little bit of motivation. We're here to support you and to act as a little bit of a check-in, or give you some accountability, and that might be very helpful. But even sharing with others maybe what your goals are, just saying those goals out loud, allow you to be accountable then to yourself and to somebody else sometimes, and that might be enough for you. You might realize that they might just ask you, how's your exercise program going, and in the future, and it would be nice for you to be able to say, yeah, I've been doing it, and noticing the benefits from it. So um, we're going to talk a little bit more about pain and trouble breathing, like I said, on the next slide. So I'll leave those two for now. And like we said, if there's any others, feel free to ask us next time you see us in person. So when we're experiencing pain in our body, it's still really important to potentially do some exercise. So when we're talking about pain, we're not talking about angina type pain. So if this is, heart type pain, we don't ignore that, or don't follow these pain rules with that. But this pain is more like our chronic pain, or sometimes our nagging muscle pains that we feel from time to time. So we want to ensure that, if we are someone that experiences pain from time to time or on an ongoing basis, that we follow two pain rules with exercise. And the first one is that pain during exercise is okay as long as we keep our pain within an acceptable level for ourselves. Okay, so it's kind of what I call that gray area. So yes, our pain might increase when we get a little bit more active, but we don't want to allow it to increase to that area, or that level where we're like, shoot, we know we're going to have to pay for this now. So we want to kind of keep it in that zone where it's manageable still for us, and it's not above an acceptable level. And then the second pain rule is usually easily followed as long as we keep to that first one. And if we keep things in an acceptable level, then what we typically find is that our pain after exercise does return back to our normal or pre-exercise levels within a day, and up to 2 days. And so we don't want to push our pain past that acceptable level. But if you notice that your pain is lasting more than 2 days, it's usually because maybe of your technique, or that you used too much load. And please talk to one of the kinesiologists at the family health team just to help you identify what that might be. Also, ensuring that you did a warm up and follow your exercise with a cool down and then stretching afterwards. Stretching can really help to delay any of that muscle soreness that we might feel later on that same day or the next day. And so, thinking about that as well as part of your pain management program, stretching is a great thing to do. So if you're feeling a bit sore from doing an activity that you haven't done in a while, or that you've never done, it's probably because of DOMS, delayed onset muscle soreness. So this is normal. I like to call it a hug from your body, kind of like your body thanking you for doing exercise. DOMS can appear up to 1 or 2 days after the exercise. But the cool thing about DOMS is that it allows the body to develop a partially protective effect. And so this happens even after just that first or initial bout of soreness producing exercise. And what that effect does is it helps to reduce the chance of developing the same amount of soreness with that same activity for weeks or months to come. And so it's really important that we want to try that activity again. And when we do it the second time, it is very likely that you're not going to be near as sore as you were the first time. The body is already making adaptations and changing to the exercises that you're trying to challenge it with. And so when we have soreness, kind of the old attitude that people took was, oh, we should rest, we should let that go away, and then we'll try again. But by doing that, the body tends to forget, and it definitely forgets this partial protective effect, and we just become sore again the next time we try it. And so really, when we have a little bit of soreness, it's actually good to move. Motion helps to kind of ease that discomfort. So stay active when you feel this. You want to stay hydrated because water will help to flush the toxins and the lactic acid that were built up from the exercise itself, which is really helpful. We do want to focus on good sleep. So we know that we want to have that restorative sleep at night. That's going to help to repair and rebuild the muscles for the work that we put them through. So that's going to help as well. Stretches. So stretches, I mentioned that they should be part of the cool down. It helps to prevent DOMS from occurring, but it also will help to ease DOMS if they happen. Okay, so stretching would be a good thing to do to kind of ease that tension in the muscles, and then definitely move again. So keep moving. It's a really great way to do that. So some of you that are listening today might be part of our cardiac rehab program, and we just want to talk a little bit about angina. And so angina is basically our heart letting us know that it's not getting enough oxygen. Usually it is brought on by activity, overexertion, sometimes even with breath holding. And so it's basically the body letting us know that what we're trying to do is a little bit too much for what the heart can handle. And so it's typically relieved with rest, slowing down or lowering the intensity, ensuring that we're breathing properly, or something that we call the walk-through phenomenon. So if you notice that you start to get a little bit of angina on your walk, if you catch it in the early stages of it coming on, if you can slow down immediately, you might be able to walk through that angina coming on at all. So by slowing down, it reduces the effort that the heart needs to keep up with and that intensity. And so the angina can go away by slowing down. Once it's totally gone, you can either maintain that new pace for the remainder of your walk, or you can slowly build it back up to your usual pace. And hopefully that pain does not come back. If it does, either repeat this process or stop altogether. Angina is not helpful if it's occurring at rest, so definitely let us know if that is the case, and we will get that investigated a little bit more in depthly for you. It is okay to feel it with a little bit of exertion. And like I said, if we can catch it right away, we can try to walk through it. If it is happening with more intensity quite quickly, and you have nitro spray, go ahead and use your nitro spray. Remember, you would take 1 to 2 sprays under the tongue, and you want to do that standing or like stopping, and not with a continued walk. But if you could sit down and take that, that would be the best. And then wait 5 minutes. If it goes away, great. If it's still there, take a second spray. If you need to take a third spray after another 5 minutes, then you do want to call 911 with that and make sure that you get some attention with that chest pain that's not going away. Angina usually feels like squeezing or pressure or maybe some type of heaviness or tightness, typically on the chest itself, but it can be up into the neck or along the jaw. It also can be between the shoulder blades or in the upper back, or it could be down your left arm. And so if you have any of that discomfort, please let us know, and we will help you understand how to best treat that when we chat together. So shortness of breath can sometimes be a bit of a barrier for people, and it doesn't feel nice to feel short of breath, and so it's hard to actually continue your exercise. So we do want you to notice that your breath has increased from rest, but it shouldn't get to the point where you're getting really short of breath or it's feeling uncomfortable for you. And so what happens is to avoid getting really short of breath, we want you to kind of ensure that you're going at the proper pace for you, and also that you're learning to kind of use your breath to help you stay relaxed within the exercise that you're doing. And so sometimes just being nervous about getting short of breath is actually contributing to your shortness of breath. And so using pursed lip breathing and slowing your pace down to kind of regulate your breath again when you notice you're getting really short of breath is a helpful tool. And so remember that pursed lip breathing would be breathing in through the nose and then slowly letting the air out through your mouth. And we would just kind of change that shallow kind of paced breathing to kind of slower in through our nose and out through our mouth type of breathing. So this is helpful for our pulmonary patients who might be listening on the call today. and have some lung issues. And you can either stay at that slow pace that helps to kind of manage your breathing, or if you feel comfortable again, you could try to slowly increase back to the previous pace and continue that for the remainder of the time, as long as we're not pushing you into getting really short of breath. The other technique to manage your shortness of breath could be to use a puffer. So if in the moment your breath has gotten you to a point where you would like to take your puffer, then please go ahead and do so. And if you notice that you're consistently getting short of breath with exercise, a technique you could consider using is checking to see if you can take your rescue inhaler 5 minutes to 10 minutes before starting the exercise. And that will just kind of open up the airways and allow you to have a better ability for your breath during exercise that particular time. So another thing to try. So feel free to talk to one of us at your program if you are experiencing some difficulty with shortness of breath, or especially if you're kind of feeling that you're anxious about your breath, and that's kind of fighting, that's kind of your body kind of fighting you on wanting to exercise as well. So anxiety will kind of heighten that shortness of breath too, and so we can give you some tips on how to kind of get comfortable with increasing your breathing rate, because we do need you to huff and puff a little bit when you're exercising to be effective. So we're happy to work with you on that. So another thing you want to take into consideration is if you have diabetes. And so regular exercise is one of the most important things you can kind of do to help lower and manage your blood sugars. So we always encourage people to walk off those high blood sugars. If you're noticing a high reading, then exercise can really help to manage that. So you definitely want to ensure that you're managing your sugar. So consider your pre and post exercise checks on your glucose monitor. You want to definitely keep a snack or a fast acting glucose tablet on hand in case you are someone that's susceptible to getting a low sugar reading. We also want you to know your symptoms and understand what are your low and high sugar levels, and that you ensure that you're able to drive, on the way home from your exercise program based on what your sugars might be. And you definitely want to be aware that with diabetes comes sometimes some neuropathy. So that's kind of loss of sensation in the hands and, in the feet, particularly is what we're speaking to here. So we want to make sure that you're wearing comfortable and proper fitting socks and footwear, just to ensure that we're not creating any blister or rubbing on the feet that could eventually turn into ulcers. And it's a little bit more difficult for people with diabetes to heal some of those things like that. So we definitely want to prevent them from happening. So knowing kind of what's going on with your diabetes and what puts you at risk for those things. And so if you have diabetes and are working with one of us kinesiologists at the family health team, feel free to ask us any questions, and we can kind of help ensure that you're taking all the considerations that you need to with your diabetes when it comes to exercise. So we also have some guidelines around exercise when you're ill. So basically, if you have a fever, you're off the hook. You kind of want to avoid exercise until you're fever free for at least 48 hours. After that, you can kind of return to your normal exercise routine on a gradual basis, and things should be fine. But if you have a cold or a mild flu and no fever, then mild to moderate exercise is usually okay. Just kind of let your body be your guide. Exercise really kind of helps to get things and congestion kind of moving. And so it's really kind of helpful when we have like that nasal or sinus congestion. Sometimes, though, when we have congestion in our lungs, we might want to be a little bit more careful. When we're congested and we have that chest kind of cold, it might already be difficult for us to breathe. So we don't want to be pushing it too hard. So really keeping the exercise more to the mild side. It'll still help get some of that congestion moving and allow you to kind of maybe have some productive coughs and kind of release some of that phlegm that's kind of causing some of that congestion in the chest. But you do want to be a little bit more careful with that chest congestion, just to make sure that your breathing is going to be okay with your exercise. So things to think about when you're not feeling well. So warm weather. So heat and humidity definitely increase the amount of stress on the body as it tries to remain kind of maintain its core temperature and its fluid balance. So we want to kind of monitor our exercise intensity with this. A lot of our smartphones, we have our weather apps, so they kind of let us know different indicators that are happening in terms of temperatures and just kind of the humidity index and different indexes on our phone. So kind of use those to kind of help gauge and plan your activity. You definitely want to stay hydrated when you're being active in the outdoors when you're in warm weather. So trying to increase, your intake 4 ounces for about every 10 minutes of moderate to vigorous activity that you're having, participating in the warmth, just to make sure that we're not losing too much fluid and getting dehydrated from that. Definitely, we talked about choosing your timing already, but maybe thinking of earlier mornings or evening walks instead. Dressing appropriately so that we're not getting warm from what we're wearing. And we definitely want to kind of, like I said, check those heat safety and air quality index when planning your activity for the day. So just some considerations in the warm weather. And next, we're going to talk about some consideration for the cold weather. So with cold weather, our blood vessels constricts. This just increases how hard our heart needs to work. And so some of the considerations we want to make with cold weather are a little bit different than the ones we are making with warm weather. So with a cold weather workout, we definitely want to increase our warm up. Our warm up probably should double to almost 10 minutes just to allow the heart, sorry, not necessarily, well, the heart a bit, but more so the lungs to acclimatize to the coolness that you're exercising in. You definitely want to dress accordingly. So I usually encourage people to dress in layers. When you step outside, you shouldn't feel like you're going to be warm and that you could stand and be okay. You should almost feel a slight bit cool when you step outside at first, because remember, you're dressed for being active outside, not for just standing still. And so, but make sure that you're not underdressed, and if you are overdressed, then make sure that as you're getting into your exercise a little bit more, that you can take a layer off to kind of manage that temperature for your body and not create a lot of sweat, which then can get you chilled and cold later and not helpful. And so making sure that we do dress accordingly for that. We want to monitor our intensity, and our intensity can really change in the wintertime because of what we're walking on underfoot. If it's snow built up on the sidewalks or some ice, then that's going to change, and the intensity that the walk feels like to us. So we're not going to be able to walk at the same pace we would on a dry sidewalk compared to one that is snow covered or a little bit icy. And so we want to kind of manage the cold air we breathe in, especially if we have cardiac issues or angina. We might want to put a scarf over our mouth so that we're breathing in a little bit more warmer air, and that'll just help to kind of manage our breathing and our angina. We also want to maybe consider, shorter walks and do it maybe more often. We might even consider shorter strides depending on the footing underneath, and when possible, choosing clear sidewalks or finding a walking track or somewhere indoors to walk would kind of resolve all of these issues as well. So there's lots of great things to do out in the winter, snowshoeing and skiing, but we just want to kind of be safe when we're doing that as well. So if you have any questions or any concerns about warm or cold weather exercising, feel free to ask. So it's important to progress your exercise. So as exercise gets a little bit easier, that's a great feeling. It's our body's way of letting us know that it's getting stronger from the challenge we gave it. But if we want to see more strength or more increased in energy or more increases in our endurance and our stamina, then we want to ensure that we progress our exercise to ensure that it still feels like a moderate intensity. And so ways that you would increase or progress your aerobic exercise would be start with increasing the duration and the frequency to build to the guidelines that we mentioned in session 1. we also want to then follow with building the intensity. So once we reach those duration and frequency guidelines, then we can work on going a little bit faster or a little bit faster, or finding more hills on our walks, for example, as a way to increase the intensity with our walk. With strengthening, what you're going to do is you're going to initially start with increasing the amount of repetitions that you do of that exercise. You might also increase the number of sets. So remember, a set is might be one set might be a number of repetitions like 10, and you could increase to 2 sets of 10 repetitions. And so you could increase the number of sets. And then once you've got your goal of repetitions and sets for each exercise, then you could work on maintaining that, but increasing the load with which you do those exercises. And so increasing your weight by 1 or 2 pounds and working with that new weight with your exercises. So again, these are the strengthening exercises will be reviewed with you in your cardiac and pulmonary rehab exercise programs. If you're not in either one of those programs, feel free to talk to the kinesiologist at the family health team, because we're happy to give you a home-based exercise strengthening program to follow along with. So when we talk about progressing our exercise, we want to make sure that we're not progressing it too quickly. So sometimes people try to do a little bit more each day, and then the body catches up and it says, woo, this is way too much too soon. And so we've kind of come up with some guidelines as to know when are you ready to increase your exercise or progress your exercise. So you're ready to increase or progress your exercise if you feel like, gosh, I want to see some more changes in my current fitness levels, and if the things that you're doing currently feel easy. So that would be that your RPE, or your rate of perceived exertion, so how much effort this exercise is feeling like, has gotten a bit lower, then that's probably a good indicator that you're ready to progress. If you're using a heart rate range for exercise and you notice that you're below your target, then you might want to increase. Okay, based on the body also telling you that it feels easy as well. So if your heart rate is below target, but your body tells you that it feels like work, then we're just going to wait until the body is happy, or it doesn't feel like as much work, so that it's starting to feel a little bit easier. And then we can work to get a little bit higher into our heart rate range by progressing our exercise at that time. But if it's still feeling like work and our heart rate is below, then we want to keep doing that level until our body has adjusted and gotten used to that level of exercise. Maybe we are feeling like we're kind of in a rut and we kind of need a different activity. We've been doing the same walk over and over again, and we're not feeling like we're making any changes. And so that might be something that you could consider progressing at that time. Or if you want to add in more activity, or you no longer feel challenged by your current workout. Those are usually all good signs that you're ready to kind of make some changes, or to kind of progress or add something in new. And so feel free to talk to one of the kinesiologists to get some tips on how to do that, or take the tips that we've mentioned earlier, where you might want to increase your duration and or your frequency to kind of help to progress first. And then once you max that out, then you can progress your intensity. On the other side of the screen here are the lists of things that we want you to keep in mind that tell you that you're just not quite ready to progress. So if you're pretty happy with your current fitness level and how you've been feeling, and you just want to maintain where you're at, you're not interested in improving further, but you're happy with where you're at and you're interested now in maintaining, then you don't need to progress. Just keep doing what you're doing, and that'll help you maintain where you're at. You're not ready to progress if the exercise feels like some work. Okay, so if that rating of perceived exertion, what you think, how much work that felt for you to do that exercise, is effective for you and feeling like a workout, then you're good still. If your exercise heart rate is going higher than your target range, you definitely don't want to progress yet. We want to try to keep it in our target heart rate range. If you've had some changes in your health or some changes in your medications, make sure you talk to your kinesiologist or your family doctor or nurse practitioner about when you might be ready to progress at that point. If you have muscle or joint injury, especially something acute, you definitely don't want to progress. If it's something ongoing, but it's kind of getting exacerbated from your exercise, then that's also an indication that you don't want to progress your exercise at that point. You want to kind of let the body get used to that level before we try to go higher. If you notice that you're not breathing well, if you're kind of holding your breath, especially with resistance training exercises, then you're not ready to progress. You definitely want to understand how to pair your breath with your movement and to do it properly before you try to keep progressing with that. Those are the main kind of points that we wanted to touch on in terms of progressing the exercises. I would just say when in doubt, reach out, and we're happy to kind of review with you what you should be doing. Oftentimes we can kind of see when things start to feel a little bit easy, then that's usually a good sign to say, hey, I need to do a little bit more. Just make sure that they've been feeling easy for at least the past 2 or 3 workouts consistently, that it wasn't just a good day for you because you had a great sleep, or the sun is shining and it hasn't shone in a number of days, and that's why it felt a little bit easier. So we can get into that routine of trying to increase things too quickly just based on one workout, but we want to make sure that we've consistently felt that way. All right, next we're going to talk about how to stick with it. And this is sometimes a little bit of a hard thing. A lot of us can get started, but then over time we get busy and we kind of let exercise be the first thing to drop off sometimes. So making goals is a nice way to kind of help you stay motivated, and it gives you something to kind of work towards. um, with making goals, it's good to kind of track your physical activity. Sometimes that's a nice way to kind of see how far you've come. But also, if you're having a bad week, you can kind of look back to what you did last week or the week before that, and notice that, gosh, I've been consistent up until this time, so I can keep that going. And it's just this week that I'm having a little bit of trouble with. And I think it's more about being kind to yourself and trying to motivate yourself as you would a good friend or someone else that's going through the same thing that you're doing right now. Finding activities that you enjoy and are fun for you to do are good things to kind of help you stick with it and stay motivated. Maybe finding a friend to walk with or joining a group to do things with is really helpful. There's a lot of free community exercise programs that you can kind of participate with. So that gives you a bit of social, but it also fits the bill for some exercise in your regular routine as well, which is lovely and very important. Sometimes a wearable like a pedometer or a Fitbit, or even a lot of the watches now just kind of track your motion, or even send you little reminders to kind of move in the hour, which is important because we know sitting is not helpful. And we learned a lot about that in session 1. But it is almost as bad as smoking, too much sitting. So we want to kind of make sure that we are just trying to incorporate some regular routine and movement into our day is helpful. So this is the tracking tool that we use in our gym classes. It just kind of helps you kind of keep accountable, but it also kind of helps you plan out your week ahead. It also lets you look back on past weeks and see kind of your performance and how you've been doing, and monitor your intensity and tracking your progress throughout throughout your goal. And so it gives you space at the top to kind of write in an action plan of what you want to do this coming week, how much of it and how often, rating your confidence on that scale of 0 to 10, and then recording in how much activity that you're doing each week, and allowing you to incorporate your rating of perceived exertion. So how much work did that bout of exercise feel like, rating in on a scale of 1 through 10, where our goal is that green area of 3 as moderate up to 5 and 6 into the hard. So somewhere between moderate to hard is what we want to note by the end of our workout. And so tracking physical activity this way is kind of helpful. Sometimes when we just go on memory. We might think, oh yeah, I walked this week. And then when you really get thinking of it, you realize that this week was, 3 or 4 days ago, since you last walked. So we want to make sure that we're doing that more often, on most days of the week. And then at the bottom, we do have a little section for you to kind of indicate if you're noticing some changes in your body or your mood from being more active. And there's lots of things that could incorporate, and you can kind of make a list of the things that you might notice or how you feel. There is a comment section after each time you enter in an exercise, so you're free to write as much or as little, or keep as much of a diary or as little of a diary as you want. But just tracking mood and energy levels, pain levels. It's kind of neat to see the changes as you get more and more consistent with your activity. So I'd like to share with you guys some of the skills workshops that the family health team offers. So a lot of you might be in the supervised gym sessions, which really focuses predominantly on aerobic exercise, but we do also have some strengthening and stretching exercises for the upper and lower body. There's also a video recording that are offered after the session so that you can follow for your home-based exercise program. We also have a balance and core workshop to give you exercises to support better balance and stronger abdominal muscles. And then we also have a chair cardio workout, which is great for those who have difficulty, walking, maybe even in the wintertime or just walking in general. But you don't need too much space in your home, just maybe an arm's length distance around your chair so that you can kind of do some of those exercises. And it's amazing what you can do moving in a chair that might get your heart rate up and act as some exercise. So a great thing to consider there. If you're interested in any of these, let one of the kinesiologists know at the family health team, and we're happy to help you with that information when the time is right for you. So we just kind of want to sum up our talk today.
Hi, I'm Dr. Mike Evans.
Video by Dr.
Usually
Mike
I'm talking
Evans
about the science behind best health, but today
it's called Let's Make Our Day Harder.
I wanted to start
and it's
a
just
movement.
Kind of some food for thought.
A movement called Let's Make Our Day Harder.
Why it's important to
I know that
incorporate
sounds
activity and
counterintuitive. In fact,
exercise
usually I'm
into our
asking,
regular routine.
how can I make it
So
easier to do the right thing? But let me explain.
A watch of this.
A recent review in
together.
JAMA Internal Medicine compared the health of baby boomers to previous generations. It showed what you might expect. Medical advances have led to longer life expectancies. But it also shows something else. U.S. baby boomers have more chronic disease, more obesity, and lower self-rated health than members of the previous generation at the same age, even though we smoke less and work out more than the Mad Men generation. So what's the difference? Well, I think for a variety of reasons that include technology, culture, and attitudes, we have a severe generational case of sitting disease. We watch phones, tablets, and TVs. We stare at computers while we work and pride ourselves on not moving for 4 hours straight. We don't walk to a friend's house or a coworker's office. We text them. I text my kids in my own house. Don't get me wrong, I love technology. There's lots of good to be had, but I also think we need to be mindful that as technology becomes more ubiquitous, it can loot the medicine chest of our single best treatment for good health, being active, moving. We shop on the internet instead of walking to the store. We have vacuums that automatically circulate so we don't have to. Electric toothbrushes so we don't have to move our hands up and down. With the push of a button, we can manipulate the TV, the music, the temperature. We might even choose our house based on these conveniences or on the size of the TV room or garage, not walkability. Living further away gets you a bigger house, but it can also mean another half-hour day of sitting in your car. To compare ourselves to the recent low-tech, simpler past, let's look at the Amish. The average Amish dude walks 18,000 steps a day. The average Amish woman, 15,000. American men walk 7,200 steps a day and women 5,200. In Canada, we're a bit better, and I actually find these numbers a bit high, but 2009 data show 9,500 steps per day for men and 8,400 for women. Unfortunately, this drops by about 1,500 steps a day once we hit 60. I think it's time to change our prevailing attitude. Maybe easier isn't really better after all. So how's about you and I start a movement? An anti-pushing the button so the door opens automatically for us movement. I'm I'm not talking about extra stuff like going to the gym or running. If you do that, it's great. I'm talking about the health goal of our daily habits, what I call tweak the week. It's about looking at your week and seeing where you can make it harder by taking the stairs or riding your bike or getting off a stop early on your daily commute. Have a walking meeting instead of sitting in a conference room. I had a 90-year-old patient tell me the other day that he gets off 2 floors above his floor. When I asked him why, he said, well, I can't go up the stairs too well anymore, but I can still go down. Can you flip technology and use your phone or other wearable to monitor and remind you to move or stand more? How about going for a walk at lunch instead of just going somewhere else to sit? Can you reframe buying a push mower or a rake or a snow shovel as an opportunity? Instead of driving around the parking lot for 10 minutes trying to find that spot that's 10 feet closer, can you just park farther away in that spot reserved for people who want to live longer and have a higher quality of life? Let's rethink this a bit. Let's you and I and our loved ones and our coworkers and our friends, let's all mix in a little low tech into our high tech. Let's do something that's totally in our control. Let's make our day harder.
Thanks for watching today and listening. That is the end of physical activity round 2. Hopefully this has given you some food for thought. Again, if you have any questions, feel free to reach out to the kinesiologist at the Family Health Team. We're here to help and here to get you moving. Thanks very much. Have a great day.